Every day, I encounter patients whose bodies have been quietly signaling deeper trouble, hidden beneath symptoms that most of us write off as mere annoyances of modern life. The truth is, our kidneys, those vital, bean-shaped organs nestled just below our rib cages, do much more than filter waste from our blood. They regulate electrolytes like sodium and potassium, balance acids in the bloodstream, oversee red blood cell production, and even contribute to maintaining healthy bones. When they are compromised, the effects ripple across the entire body, manifesting in surprising ways: changes in skin, nails, breath, sleep patterns, and circulation. Despite this, as many as 90% of people with chronic kidney disease remain unaware of their condition until it has advanced significantly, robbing them of the chance for early intervention and prevention of irreversible damage. Imagine noticing a persistent layer of frothy bubbles in the toilet bowl each time you urinate, reminiscent of the foam on a freshly poured beer. This is not a few fleeting soap-like bubbles, but a dense, sticky foam that lingers on the water's surface. That foam is a warning sign. Albumin, a crucial blood protein, is leaking through damaged kidney filters' microscopic structures called glomeruli. Each kidney contains around 1 million of these glomeruli, each a network of capillaries so fine that red blood cells pass through singly. Tiny, finger-like projections called podocytes form an intricate living mesh around these vessels, selectively allowing water and small waste molecules to pass into the urine while retaining larger proteins like albumin. But when podocytes become flattened and ineffective due to inflammation, high blood pressure, or other insults, gaps appear, and albumin seeps through, foaming the urine. This condition, known as albuminuria, often goes unnoticed because it is silent. The only evidence is that tenacious foam that refuses to dissipate. Albuminuria has consequences far beyond its bubbly appearance. Albumin plays a central role in maintaining oncotic pressure, the force that keeps fluid within our blood vessels. When too much albumin leaves the bloodstream, fluid begins to escape into the surrounding tissues, leading to swelling first noticeable in the legs and ankles due to gravity, and sometimes around the eyes where the skin is loose. This kind of tissue swelling, or edema, feels puffy and yields a shallow indentation when pressed. When you press your thumb against your shin bone for 5 seconds and lift it, that lasting dent is called patina edema. Paradoxically, despite the external puffiness, the blood vessels are relatively low on fluid, prompting the kidneys to react as if the body were dehydrated. They respond by retaining sodium and water, worsening the edema in a vicious cycle that can lead to fluid accumulation in the lungs, causing shortness of breath if left unchecked. Many dismiss swollen ankles after a long day of standing or a rich meal, but persistent edema, especially when it worsens around the eyes or fails to subside overnight, deserves a closer look. It could be your kidneys crying out for attention. Another early harbinger of kidney dysfunction hides in the quiet hours of the night. Most people pride themselves on a clean bill of urinary health if they can go frequently. Yet with kidney impairment, the ability to concentrate urine diminishes before almost any other function. Under normal circumstances, our bodies rely on antidiuretic hormone AD to reclaim water at night, yielding dark, concentrated urine and uninterrupted sleep. But when the kidneys falter, that concentration mechanism unravels. Water is wasted instead of reclaimed, and you find yourself rising repeatedly to visit the bathroom in the small hours, a condition known as nocturia. Frequent nocturnal trips rob you of deep, restorative sleep and are often misattributed to advanced age or an overindulgent evening beverage. In reality, they may be the earlier sign of compromised kidney filtration and water conservation capabilities. Look down at your hands and the color and texture of your nails. In healthy individuals, the lunula, the pale crescent at the base of the nail, provides a clear demarcation from the nail plate. Occasionally, you might notice faint horizontal ridges or slight discoloration, but if half of your nail plate near the fingertip adopts a reddish-brown hue while the base remains whitish, that is called half and half nails or Lindsay's nails. This striking bicolor appearance can be a marker of chronic kidney disease. Although the precise mechanism remains unclear, the association is strong enough that its presence on physical examination warrants further evaluation of kidney function. Phosphate, a mineral abundant in our diets, especially in processed foods, and sodas, also provides early warning signs. Healthy kidneys excrete excess phosphate seamlessly, but damaged kidneys lose this ability, causing phosphate levels to climb. High phosphate binds with calcium in the blood, forming calcium phosphate crystals. When these deposit in the skin, a condition called calcinosis cutis rises, presenting as hard, yellowish papules under the skin that, when broken, exude a chalky, toothpaste-like substance. Beyond the skin, these crystals can lodge within blood vessels, leading to calciphylaxis, a catastrophic condition where blood flow is choked off, tissues undergo necrosis, and the risk of fatal infection skyrockets. Milder calcifications in arteries make them visible on X-rays and palpable as rigid, guitar string-like vessels beneath the skin, mirroring what occurs when phosphate-induced bone-like changes infiltrate the vascular smooth muscle cells. To regulate phosphate, the body secretes fibroblast growth factor 23 FGF23, a hormone that signals kidneys to excrete phosphate and inhibits the activation of vitamin D, reducing both phosphate and calcium absorption from the gut. As vitamin D activation dwindles, calcium levels fall, provoking secondary hyperparathyroidism as the parathyroid glands secrete parathyroid hormone PTH to liberate calcium from bone stores. This compensatory bone breakdown, if chronic, leads to osteopenia and osteoporosis, manifested by height loss, vertebral compression fractures, and fragility fractures of the wrist and hip after minimal trauma. Monitoring bone density and markers of mineral metabolism can reveal these derangements long before a fracture occurs. Electrolyte disturbances reach beyond calcium and phosphate. Low calcium and low magnesium, coupled with metabolic acidosis when kidneys fail to excrete acid, can provoke severe muscle cramps, often nocturnal, waking patients with excruciating pain in the calves or hands. These cramps are distressing and can be misattributed to dehydration or overexertion. Yet when they occur in the absence of increased activity or new strenuous exercise, they should prompt evaluation of renal function and an electrolyte panel. While biochemical and structural changes underlie many of these signs, toxin accumulation adds another dimension to the clinical picture. As kidney function declines, retention of waste products, collectively termed uremic toxins, leads to uremia or urine in the blood. The nervous system, heart, gastrointestinal tract, and integumentary system all suffer. Itching or pruritus can become relentless, disrupting sleep and daily functioning. Uremic toxins sensitize skin nerve endings and directly deposit in the dermis, triggering chronic inflammation and unstoppable itching that often responds poorly to conventional antihistamines. Similarly, restless leg syndrome may emerge or worsen as uremic toxins drive up hepcidin levels, a peptide hormone that blocks iron absorption and sequesters iron away from the circulation, a defense mechanism against infection that becomes maladaptive when chronically activated. Iron deficiency in the central nervous system impairs dopamine production, fueling the irresistible urge to move the legs at rest and causing sleep fragmentation. Metabolic waste in the bloodstream also alters taste and smell. Uremic feta describes breath that carries a faint ammonia or urine odor caused by bacterial breakdown of urea in saliva. Foods take on a metallic or sour flavor, reducing appetite, compounding malnutrition, and leading to unintentional weight loss. Nausea and vomiting are frequent, as uremic toxins cross into the brain's chemoreceptor trigger zone, mimicking food poisoning and activating nausea pathways. Bleeding tendencies represent another subtle yet serious symptom of uremia. Uremic toxins impair platelet vessel wall interactions, leading to defective clot formation. Patients may notice easy bruising, prolonged bleeding after minor cuts, bleeding gums during toothbrushing, or frequent nosebleeds. This coagulopathy increases the risk of perioperative and spontaneous hemorrhage, demanding careful monitoring of bleeding times and potential use of desmopressin or dialysis to reduce toxin levels. In the most advanced stages of kidney failure, extraordinary signs can appear. Uremic frost, a rare finding in which sweat crystallizes urea on the skin's surface, resembles a fine white dust coating the limbs. Pericarditis, inflammation of the sac surrounding the heart, produces sharp chest pain worsened by breathing and an audible friction rub on auscultation. These manifestations signal dangerously high levels of uremic toxins and indicate the need for urgent dialysis. An overwhelming and pervasive symptom, fatigue, affects nearly everyone with chronic kidney disease. The loss of erythropoietin production by damaged renal tissue leads to anemia, sapping energy, and impairing concentration. With synthetic erythropoietin therapy, we can raise hemoglobin levels, but monitoring remains critical to avoid excessive increases associated with cardiovascular risk.